Through this Facebook Live Q&A, we will shine light on the harmful practice of taking too much OTC pain medicines. So Dr. Byron Cryer of UT Southwestern Medical Center is one of the country's leading gastroenterologists and OTC safety experts. He's been with UT Southwestern since 1992 and is a counselor for the American Gastroenterological Association. Dr. Cryer leads a campaign with the American Gastroenterological Association called Gut Check, Know Your Medicine. Gut Check provides tools, resources, and information on what you need to know to be safe with over-the-counter pain medicines. So Dr. Cryer and I are coming together today to share the common myths and misconceptions associated with over-the-counter pain medicines. Now, I have a few questions for Dr. Cryer, and I welcome you to join in the conversation. Please pose your questions and comments below this video, and we will get Dr. Cryer to answer them. And so now I'm going to turn it over to Dr. Cryer, and he's going to get us started.
Thanks, Kristen. So we're here today through the American Gastroenterological Association to talk about commonly used pain medicines, what we'll call over-the-counter or OTC pain medications. The American Gastroenterological Association, the AGA, has a campaign called Gut Check, Know Your Medicine campaign, which really has the focus to urge consumers to take their OTC medicines safely. We have been conducting this campaign for over a year now, and we thought that it was appropriate during the month of September, which is Pain Awareness Month, to help get the message out, increase awareness, talk to people about pain medicines and how to take them safely while reducing the risk.
Great. So for those of you joining us in our stream, I'd like to just remind you that we're here with Byron Cryer, who is Associate Dean and Gastroenterologist at UT Southwestern Medical Center, and we're talking about over-the-counter medication safety. So Dr. Cryer, I'd like to start by asking you, why do people turn to over-the-counter medications, particularly for pain?
Sure. So pain is a very, very, very common problem. All of us have experienced pain. And in fact, we at the American Gastroenterological Association about a year ago conducted a survey of U.S. adults 30 years of age or greater, and we found several interesting features. One of the interesting features is that about 8 in 10 people in the United States have pain. And so, one, it's just very common. Secondly, the things that we do in our day-to-day lives cause us to have pain. So maybe just getting to work or working out or taking care of your kids or running after the kids, many of those things lead to pain. So we all have pain and we all need to figure out how we manage it. One of the things we learned from the survey is that people like to be in control of managing their pain. And so there are commonly available medicines which allow individuals to manage it. And so these medicines are things such as acetaminophen or a group of medicines called the non-steroidal anti-inflammatory drugs. Acetaminophen, it has a long name, commonly known as Tylenol. The non-steroidal anti-inflammatory drugs are another commonly used group of medicines. We abbreviate it as NSAIDs. Those are things such as Advil or Aleve, ibuprofen. And in fact, there are hundreds of products that are out there that fall into either the category of acetaminophen or the category of NSAIDs. Specifically, there's 550 acetaminophen containing products that are out there, and over 500 NSAID containing products that are out there. These are very effective and very safe medicines when used as directed. But part of the problem is that people commonly will take these more than directed, and when people take more than they should, they tend to get themselves into trouble. So what we're here to talk about today is we want to make people aware of how and when they should be taking these medicines and what are the situations in which they can get themselves into trouble.
Okay, so there's a lot of information there.
Sure.
Can you, do you have an idea, can you tell me how many Americans take over-the-counter pain medicines? Is it everybody?
It's many people do. So what we know is there are 100 million people, adults, who are taking over-the-counter pain medicines. And that's out of about 300 million people who live in the U.S. What we learned from the survey is that to manage this pain, that 8 in 10 people have taken one of these over-the-counter medications over the last year, and that's medicines that's not prescribed. When you consider the medicines that are available by prescription, there are a numerous number of those as well, 4 in 10 people have taken one of the prescribed medicines in the last year. So the common reason that people get into trouble when taking these medicines is that they overdose, they take too much, or they mix medicines. And so some of the situations in which that occurs is that you may have, let's say we talked about 4 in 10 people taking a prescribed medicine and 8 in 10 taking over the counter. You might be taking over the counter, let's say Advil. And then you have a prescription in your medicine cabinet, which is ibuprofen. And you may have a common reason for pain, let's say back pain. And you reach up and you take your Advil for the back pain. And then you have a headache and you say, well, I think I'm going to take some of this prescription ibuprofen for the headache. And what you don't realize is that you've taken 2 ingredients, two products which contain the same ingredient at the same time. And even though you may be taking the Advil as written on the label and the ibuprofen as written on its label, by doubling up, by taking more ibuprofen and ibuprofen at the same time, you've essentially overdosed, and that's how you could potentially get yourself into trouble.
Gotcha. So what do you see in your practice? Do you see overdoses every week? Do you see other issues coming in related to this?
Sure. So you've introduced me as a gastroenterologist. I'm a digestive disease specialist. We focus on problems of the gastrointestinal tract, the stomach, the intestines, the liver. But here I am talking about pain. So how do you put those two together? Well, the most common side effects of the pain medicines are side effects within the gastrointestinal tract. So things such as abdominal pain or nausea or problems such as ulcers, which are holes that can happen in your stomach or your intestine, or problems with the liver. And so what we see in terms of what I see as a gastrointestinal specialist are people who've been out there taking medicines, commonly over-the-counter medicines, to help manage their pain, and they run into a gastrointestinal problem. So things such as the abdominal pain or the nausea or an ulcer. When we did the survey that I mentioned previously through the American Gastroenterological Association, we found some interesting features with respect to a gastroenterologist. So I'll take a step back and let me tell you how the survey was conducted. So the survey was both online as well as telephone, and assessed over 1,000 adults greater than 30 years of age, as well as 251 practicing licensed gastroenterologists. We asked the patients, the consumers, questions about their medication habits, and we asked the physicians, the gastroenterologists, questions about the patients they saw and the types of problems that the patients encountered. What we found through the survey from the gastroenterologist responses is that the patients commonly get into problems. So a gastroenterologist like myself, we found that on average we see about 2 of these complications per week. So in general, 90 to 100 complications over the course of a year. So it's a common problem for us to see, and people will end up in the hospital with complications related to ulcers. So to give you an example, recently I had a patient, 37-year-old woman I was called to the emergency room to see, who presented to the emergency room vomiting blood. It turns out then, when talking to her, that she had been taking ibuprofen for 4 days because she had been doing aerobics and she had knee pain. And after only 4 days of taking the over-the-counter ibuprofen, she ended up with this problem of vomiting blood and presented to the emergency room. We admitted her to the hospital, did endoscopy, which is a common thing that a doctor like myself, a gastroenterologist, will do. And on endoscopy, we found that she had 1 centimeter, which is about a ½ inch bleeding ulcer. We took care of the ulcer. She healed quickly and was discharged and went back to her normal life without event. But there were a couple of interesting things that she said to us. One, she said that she didn't know that the ibuprofen could cause a bleeding ulcer. Also, she said that she felt like if she were going to have an ulcer, that she should be have pain. But in fact, most patients who have ulcers have this problem with the pain, these over-the-counter pain medicines. They do not have any symptoms. The first time that she presented to the hospital was when she came in vomiting blood. And in fact, 80% of people who come in with the complication related to an over-the-counter medicine will not have had any symptoms whatsoever. And the other thing that she found surprising, which is a common characteristic of patients who are taking over-the-counter pain medicines, is that she said she felt like because they were available over-the-counter, they had to be safe. And so she felt like she could take more than recommended because they were over-the-counter. And typically they're going to be safe. People, when they follow the instructions, when they follow the label and follow the guidelines, they generally will not get into any trouble. But people get into trouble when they take more than the recommended dosage, or when they double up by mixing medicines of 2 different brand names that they didn't recognize were the same medicine.
Great. Well, thank you, Dr. Cryer. I know we've got lots more to share. Wanted to remind everybody who is watching our broadcast that please feel free to ask questions. We've had some come in already, but you just ask the questions in the comments field below the video and we will ask Dr. Cryer for you. So in the meantime, what should patients and consumers look for in a pain reliever?
So the most important thing to do when one reaches in the medicine cabinet for the over-the-counter pain medicine is to read the label. Read the label. Know what you're taking, and follow the guidance. Follow the guidelines that are in the label. What we found in the survey is that people thought that the label was a guidance, not necessarily a strict guideline. And so it's important to read what you're taking. When you think about, when you go to a restaurant or when you go to the grocery store, we're in the habit these days of reading the label. We know how many calories are in this can that we're about to consume. We know what's the percentage of carbohydrates, proteins, fat. Well, if we're going to spend the same amount of time reading the label on the foods that we consume, we should apply the same amount of diligence to the medicines that we take. So we want people to know what they're taking. We want people to read the label. The other important thing that's important is when you go to a physician for your routine health encounters, it's important to talk to your healthcare provider about what you're taking. Not only the things that are prescribed, but also the things that are over the counter. while you're sitting there waiting for your appointment, we typically are filling an intake form, and it may ask you the question, what medicines are you taking? It's important to remember when you see that question, what medicines are you taking, to not only list the prescribed, but list the things that are available over the counter. The other thing that's important for patients to remember who are taking over-the-counter pain medicines is that when they reach in the medicine cabinet, that it's not only things that you would think are labeled for pain, such as Advil or Tylenol or Aleve, that you have to be cognizant of. But remember that commonly taken cough, cold, flu, allergy medicines also contain these ingredients. So a common situation may be you're taking for your back pain acetaminophen, Tylenol. And now that we're approaching allergy season, you have an allergy and you reach up and you take one of these allergy preparations, which guess what? Also contains Tylenol. It may not say Tylenol, it may say acetaminophen. And you're back into the same situation of overdosing.
Gotcha.
And so it's really important to know the medicines, to read the label, and to be aware of all of the ingredients of all the medicines that we're taking, both over the counter as well as the prescribed.
So given that, I mean, what are your patients saying regarding this? Are they struggling with following this advice? It seems pretty basic.
Yeah. So one of the things, we found out several interesting things in the survey. A few of the things that we found out from the patients as well as the gastroenterologists were that, one, patients want to be in control of their pain. And that's why over-the-counter medicines are so commonly taken. That's a good thing, to be in control of managing your pain. We just want patients to do it safely, and we want them to do it in an informed fashion by knowing what they're taking and reading the label. What we found with respect to some of the situations that people get into trouble with when managing their pain was that people want to feel better faster. So if you are in pain, if 2 is good, if the label says take 2, well, 4 must be better, right? And we found in the survey that people commonly will take more than the recommended dosage. This is not always, taking more is not always a good thing, and sometimes gets people into trouble. Let me give you kind of a way to think about it. So when you have pain, typically it's your nerve endings that are sensing that pain, right?
Okay.
And on the end of the nerve endings, we have things that are called little receptors, which is what signals the pain.
Right.
When you take a pain medicine, the pain medicine goes and sits on those receptors to kind of block the pain. So when one is taking medicine and you're taking a certain amount of it, and you've taken enough medicine to fully occupy those receptors, well, taking more isn't going to lead to a greater reduction in the pain. Think about it this way. When you get on a plane, right, and the plane has a certain capacity of seats. Think of the receptors on those nerve endings as the seats.
Okay.
As you fill that plane with passengers, think of the passengers as the pain medicines. Once all those seats are filled to capacity, as you increase more passengers on the plane, you only increase the risk. And that's what's happening with pain medicines when people take too much. That once you've reached the maximum dosage, you typically are not going to get any greater pain relief by increasing the dosage over the recommended amount, but you only get increasing risk.
So, a question from Forrest Kane. So, Forrest is wondering, is ibuprofen or NSAID in general really harmful for your digestive tract? If so, what are good alternatives for treating chronic back pain?
Sure. So, ibuprofen, as any of the NSAIDs, and there's, as we've discussed, several NSAID products that are available, that are out there. They're very safe medicines, very effective for managing pain when taken as recommended. Force where you get into trouble is when you take more than the recommended dose. So what you want to do as an alternative, let's say you've taken as much ibuprofen as is recommended on your bottle of Advil or whatever the ibuprofen product may be that you're taking, but you still have pain. So what do you do in that situation? Well, one strategy is you can combine various pain products from different categories. So let's say I'm taking an NSAID product over here, ibuprofen, but I still have pain and I want to have additional pain relief. Well, you might consider taking an acetaminophen containing product, or vice versa. Let's say I'm taking Tylenol for my pain and I've reached the maximum recommended dose that's on the label, and I need additional pain relief. Well, that's a situation where you might consider taking a little ibuprofen or naproxen. But for us, what you don't want to do once you've reached the maximum recommended dose of ibuprofen is take another NSAID containing product. So specifically, the example would be, let's say I'm maxed out on my ibuprofen. I don't want to take additional naproxen on top of the ibuprofen, because what I've done is take two products within the same category. I've exceeded the recommended dose, but I've only put more passengers on that plane that's already at capacity, so I've increased the risk.
So we've got another question. This one's from Doug. So Doug is wondering, he says, I recently learned that prolonged use of Alka-Seltzer could be dangerous for one's health. What is too much for over-the-counter items like Alka-Seltzer, Tums, that sort of thing?
Sure, that's an excellent question. Thanks for raising the question, Doug. It brings up a common situation that we, Kristen, haven't discussed yet, which is what we've talked about so far, is that these commonly available pain products, such as aspirin or ibuprofen or naproxen, are available labeled as a pain product, right? Also available as a prescribed product. But in addition to that, it's available in other preparations, and Alka-Seltzer is one of those common preparations that you most people don't recognize is an NSAID. Alka-Seltzer is aspirin. Overdose situation by combining the Alka-Seltzer with ibuprofen, because they're both NSAID containing products. So I believe Doug's question was, how much Alka-Seltzer can he take? Well, if you're not taking any other NSAID containing products, Doug, you can take as much Alka-Seltzer up to what's recommended on the label. So you can go up to the 1 to 2 tablets every few hours as suggested. The other thing that's important to recognize that I think we want the community, the Facebook community, to know about the over-the-counter pain medicines is that these are not medicines that are intended to be taken forever. They're typically for short-term use, usually no more than greater than 10 days without talking to a healthcare provider. So if you have a problem, let's say, for many of us, back pain can be brief, but for many people, back pain or other types of pain can be chronic. So if you anticipate that the need for the pain medicine is going to be longer than 10 days, then check in with your healthcare provider and just make sure that the dose of medicine that you're taking is appropriate, and make sure that the healthcare provider is in agreement that this can be taken for longer periods of time.
Now, all really good pointers, Dr. Cryer. So we have another question. This one is from Corey. So Corey has been dealing with a fractured foot, so she's been taking some prescription pain medication, but she also gets headaches occasionally. And I know we can't discuss specific patients, provide medical advice, but she's wondering, what do I need to know about mixing prescription and OTC meds together?
Sure. Another great question, Corey. Common situation in which people get into trouble. Remember, we talked about, you have the prescribed pain medicine. Let's just say Vicodin, for example. So Vicodin is acetaminophen with codeine. And then you will be taking potentially Tylenol. So the situation that you can get into trouble Corey, for managing your foot pain is when you're taking that prescribed medicine and when you're also taking the over-the-counter medicine, and they contain the same thing. So what do you do? First, you have to know what's the active ingredient. So read the label and know the medicines, know the ingredients. And by knowing the ingredients, you can reduce or eliminate the likelihood that you're going to double up. So it's one of our most principal messages in our campaign is to know your medicines, know what you're taking. And if you know what you're taking and know the active ingredient in the pain medication, you reduce the likelihood that you're going to double up by combining the same active ingredient and inadvertently overdosing.
So we are nearing the end of our time, but we did have one other question. It's Amanda. She's had severe scoliosis and had corrective surgery. She's wondering, as she gets older, as she ages, what does she need to think about when taking over-the-counter medications?
It's an excellent question, Amanda. And one of the things we haven't mentioned is that, people's personal health condition changes over time. And so individuals with scoliosis not uncommonly have chronic pain, and they're used to taking their pain medicines. But as I age and as I've been taking this pain medicine over time, my risk as a patient changes as well. So it's important to recognize that our own health conditions change. And for that reason, even if we're very familiar with the medicine that we're taking, we should check in with that label every once in a while and see whether the amount, the dosage that we should be taking is modified based upon our increasing age or our changing health conditions. The label will tell you several important things. And one of the important things is the amount and when and who should be taking the medicine under what certain conditions. And so as our health condition changes, we need to check in with a healthcare provider and check in again with the label. We learned from our campaigns that there are several important misconceptions that are out there that I think are important to cover with the Facebook community. We like to think of them as myths and facts. So one of the myths that we learned that's commonly thought about out there is that people think that the drug labels are guidelines, just guidelines. Well, that's the myth. The fact is they're not guidelines, but it's strict guidance. So understand what the label says and understand how your specific health situation applies to that. The other myth is that people think that taking more than the recommended dose is harmless. But the fact is that taking more than recommended is a harmful situation. And the other myth the final myth that that was revealed in the survey was that people feel that mixing medicines is safe and effective. Mixing medicines, the fact is mixing medicines is a dangerous situation, and we don't want you to do that.
Awesome. So do you have any, as we're rounding up the time, do you have any tips or takeaway messages for those who've been following our stream?
Sure. So 3 important takeaway messages that we want people to walk away with. 1, we want them to know their medicines, know what they're taking, know the active ingredient in the medications. That's critical, because if you know what you're taking and know the active ingredients, it's less likely that you're going to double up on your medicines. Secondly, only take one product containing the same active ingredient at the same time. So know the medicines and only take one active ingredient at the same time. And the final takeaway message is that there is much more information that's out there on our website. We have a website which is a lot of fun, interactive games, lots of good resources and information at gutcheckfacts, all one word, .org, for many more tools and resources.
Well, great. Well, thank you, Dr. Cryer, for your time and for sharing this important safety information with our patients and with our families. So stay tuned. Once we are off air, we're going to be sharing the entire segment here. We're going to share it across our social platforms. Be sure also, as Dr. Cryer said, visit gutcheckfacts.org. That link will be in the social shares that we put out later today. So again, thank you very much and have a great day.
Thank you.